I'm Dr. Karen Dunbeston, an infectious disease physician at McLaren Northern Michigan Hospital and the medical director of infection prevention. Last time I checked in with you on social media about COVID-19 was 3 weeks ago. At that time, we had a limited number of COVID patients in the United States. Since this time, however, we've seen rapid spread of this disease across the United States, and now we have cases in all 50 states, including Michigan, and cases in northern Michigan. We also have suspected cases under investigation in our hospital. I'd like to point out 3 things about COVID-19. First, in the United States, we have not had the ability to adequately test the number of patients that need to be tested. So the numbers that you're seeing in the community vastly underrepresent the amount of COVID patients out there. Secondly, patients who develop COVID infections typically will have a mild illness with influenza-like symptoms with fever and cough, but those are the patients out there that can be spreading the illness to other people. Older patients and those with underlying illnesses are at increased risk for developing severe disease, hospitalization, and increased risk for dying. And thirdly, if we don't slow the rate of transmission of this virus, healthcare facilities will be completely overwhelmed and unable to care for those in need due to a rapid influx of patients requiring intensive care. So it's so important for everyone to act together as a community, to do their part to socially isolate and spread and prevent the spread of this illness and slow it down. I know I'm asking a lot. People have spring break plans, they want to gather socially, but we need to reconsider if these things are absolutely necessary. If we fail to do this, medical facilities will be completely overwhelmed and the most vulnerable in our community will be at risk. So what should you do if you get COVID symptoms? Typically, again, fever, cough, shortness of breath. Most people will be able to stay at home and recover and do well. Isolate yourself from other members of your house. Clean your hands in those high-touch areas and monitor your symptoms. If you do get sick and you feel like you need medical care, we are here and prepared to take care of you. Please call your provider or the emergency department and let them know there's a COVID risk so we can take the necessary precautions to keep everybody safe. We do have a triage line set up and there's good information on the McLaren website to help you walk through some of your symptoms. So please, spread the word and protect the herd.